chromium process or chromium, okay? And it makes contact with the clavicle, so it makes you a chromioclavicular joint or AC joint, okay? And a chromioclavicular ligament locks in place. We'll do that lecture tomorrow. All right, so here we got the spine and the scapula. Now these are child depressions. They're called fossa. So spine and scapula, you got the supraspinous fossa, infraspinous fossa, and in the front, subscapular fossa. Okay? So supra, right, above the spinous scapula, infra, below, and sub. Okay, subscapular fossa. What's important here, we'll go over this when we do muscles, the muscles of the rotator cuff right here. So supraspinatus, infraspinatus, subscapularis, okay, and then teres minor, right, like that. Okay? We have a vertebral or medial border, and we have an axillary or lateral border. Okay, we have a superior and an inferior angle. If we go anterior, right, there's another little hook here. It's a coracoid process. Coracoid process. So the coracobrachialis muscle attaches there. Makes you do that. Okay, makes you flex the shoulder joint. Okay, and then a glenoid cavity or glenoid fossa makes a ball and socket joint. So the head of humerus goes there, head of humerus. Okay? So again, the arm bone is the humerus, right? The smooth part is the head. And again, it's going to have articular cartilage there, same as the glenoid cavity. Okay? It's going to be made up of hyaline cartilage. So right here, the head of humerus, and right here, okay, it's going to be the neck. It's going to be the neck. So you got a head and you got a neck. Okay? Then you got these two grounded projections. Lateral is going to be the tubercle. Medial is going to be the lateral is going to be a greater tubercle. Medial is going to be the lesser tubercle. So greater and lesser tubercle. And in between here, we got an intertubercular sulcus. An intertubercular sulcus. Okay, it's a sulcus is a groove. It's in between the two tubercles. They also call this the bicipital groove, because the long head tendon or biceps brachii muscle goes right through there and attaches to the glenoid cavity. Okay. Now, underneath the two tubercles, there's a name that surgeons gave this. Okay. They call it the surgical neck. Okay. Statistically speaking, this is the most broken part of any other bone. Okay. So, head, neck, greater tubercle, lesser tubercle, intertubercular sulcus. Okay. You come down here, there's a little bump. It's called the deltoid tuberosity. Okay, the deltoid muscle attaches there. So the deltoid muscle originates at the clavicle and spine of the scapula, but it inserts into that deltoid tuberosity. And if we go distally now, right, the smooth parts here in the elbow joint, these are condyles. Okay, you got a lateral and medial condyle. Unfortunately, in the upper extremity, they give these condyles names. The lateral portion of the humerus, the condyle, is going to be the capitulum. The medial portion is going to be the trochlea. So capitulum and trochlea. Above those condyles, lateral and medial epicondyles. Lateral and medial epicondyles. Okay? All right. So the lateral bone, we're going to do posterior in a second. Lateral bone in the forearm is called the radius. Lateral bone is the radius. Proximally, it's rounded. It's the head, the radial head. And it's got an annular ligament there, round ligament. So what the radius does, it rolls over the ulna. So it does pronation and supination. Okay? If you go distally, you got a styloid process there. Styloid process, muscle attachment. The medial bone of the forearm is the ulna. Okay? Proximally up top, okay, what makes contact with the trochlea is going to be the coronoid process. Coronoid process. Go distally, got a round part, it's called the head, and you have a styloid process there too. Turn it posterior, okay, so in the humerus, you got this little hole here, okay, it's called the olecranon fossa. So if you bend your arm, you can push in there, but that's that little hole. So you got the olecranon fossa, okay. What fits in a fossa is the olecranon process of the ulna. So the olecranon process of the ulna, it's almost like a hook that fits in there, okay, fits into the olecranon fossa, makes a hinge joint, okay. Okay, then again, right, carpal bones, yeah, scaphoid lunate, triquetrum pisiform. Okay, go to the thumb side again. Trapezium, trapezoid's the real small one. The real big one's the capitate, and then the hamate's got a little hook on it. Okay, The hand bones are metacarpals, metacarpal 1, 2, 3, 4, and 5, each individual bone, right? Proximally got a base, a shaft, and distally a head. The thumb has 2 bones, proximal and distal bone. All the other fingers have 3, proximal, middle, and distal, and they all have a base, a shaft, and a head. Okay. All right, now we got the pelvis. So the top bones, the ilium, anterior bone is the pubic bone, the posterior bone is the ischium. Okay, so if we're looking at the top of the ilium here, okay, the top part's called the iliac crest. Okay, then you got like a bump here in the front, and 2 bumps in the back. Okay, so these are called iliac spines. So if you go in anterior, you got anterior iliac spines and posterior iliac spines. The one on the top is superior, the one on the bottom is inferior. So this is going to be the anterior, superior iliac spine. Okay, still anterior, inferior iliac spine. Go to the back. You got a posterior, superior iliac spine, posterior, inferior iliac spine. So it's very easy to tell you where they are. Okay, then right here you got a greater sciatic notch and a lesser sciatic notch. Greater sciatic notch, lesser sciatic notch. Sciatic nerve is right down there. Okay, and then you got this little thing that sticks out. That's called the ischial spine. Ischial spine. So greater sciatic notch, lesser sciatic notch, ischial spine. The ischium's got these roughened projections. Those are called tubercles. Okay, muscle attachment. Your gluteal muscles attached there. I'm sorry, your hamstring muscles originate there. Okay, the bone in the front, pubic bone, you got pubic tubercles. All 3 bones come together and you make a cup. That cup's called the acetabular. Acetabular. Okay, and we got the femur bone, okay, or your thigh bone, okay, what fits into the acetabulum. It's a ball and socket joint, just like the humerus. So that's going to be the head. Got a head, we have a neck. Okay, then we have roughened projections. Roughened projections are called trochanters. So up in the humerus here, they're rounded. Okay, so they're tubercles. Here they're roughened, trochanters. So laterally we have a greater trochanter. Medially we have a lesser trochanter. The big thick part here is an intertrochanteric crest, and the front's an intertrochanteric line. Okay, got a little thing that looks like a V here. Okay, that's where the gluteus muscles attach. Okay, it's called the gluteal tuberosity, and this little ridge here is called the linea aspera. Okay. If we go distally, right, the nice smooth part that's covered with cartilage, okay, articular cartilage, those are the condyles. So in the upper extremity, the condyles had names, capitulum and trochlea. These don't. It's just lateral and medial condyles. Okay, lateral and medial condyles. Above the condyles, lateral and medial epicondyles. Okay, so the condyles of the femur make contact with the condyles of the tibia. That makes your knee joint. Okay, kneecap's called the patella. Okay, the shin bone is the tibia. On top, you have a tibial plateau, and it's a little bumps of tibial tuberosity. Okay, so the patella ligament attaches there. Okay, if we go distally in the tibia, the bump on the inside of your ankle is the medial malleolus. It's the medial malleolus. The lateral bone in the leg is called the fibula. Proximally, you have the head. Distally, right, the bump on the outside of your ankle is the lateral malleolus. Lateral malleolus. The 2 malleoli make contact with the first tarsal bone. It's called the talus, right? And so the foot's going to go plantar, the dorsiflexion and plantar flexion. So we're going to go over all those tomorrow. Okay, so 2 malleoli. You got your talus, anterior to the talus, you got your navicular bone. Anterior to that, you got your first, second, third cuneiform bones. Okay, so talus, navicular, first, second, third cuneiform bones, and you got a cuboid. Okay, the heel is called the calcaneus. Heel is the calcaneus. So talus, navicular, first, second, third cuneiform bones, cuboid, and calcaneus is the heel. Bone in the foot, metatarsals, right? They go start at the big toe, metatarsal 1, 2, 3, 4, and 5. They all have a base, a shaft, and a head. Phalanges in the lower extremity, just like the upper extremity, right? Thumb and big toe have 2 bones, proximal and distal. All the other toes have proximal, middle, distal bones, and they all have a base, a shaft, and a head. Okay? And that is about that for the whole skeleton. Okay? So we'll come back on next week. We'll take the test. Okay? If you want to review. If not, you just go take a rest. All right? So we'll do joints tomorrow.